Hello class, this is Dr. Ghazal and we are continuing with the topic complications of gonorrhea. Today we are going to learn the metastatic complications of gonorrhea. As the name suggests, it is caused due to the bacteremia of gonococci. This bacteremia seeds the infection elsewhere in the body. This seeding of infection elsewhere in the body will cause something known as disseminated gonococcal infection, DGI. Most common presentation is the dermatitis arthritis syndrome. So it has two components, the dermatitis part and the arthritis part. In dermatitis, you'll mainly see pustules, or it will be a vesicopustular eruption, but it can be anything like macules, papules, petechiae or ecchymosis. While in arthritis, the most common presentation is joint pain, that is arthralgia. So there can be arthralgia, there can be arthritis and tenosynovitis. Now, in this syndrome, about 60 to 90% of DGI will have dermatitis, while only 30 to 40% will have the arthritis part. Sometimes the triad of dermatitis arthritis syndrome is asked, and the triad will include dermatitis, arthritis and tenosynovitis. So this will be the triad. As already mentioned, the cause of DGI is bacteremia in acute gonorrhea. It is seen in 0.3 to 4% of untreated gonorrhea, and it is more common in females. Gonorrhea as such is more common in males, but DGI is more common in females. The cause being females are less symptomatic than males. So they go untreated, unnoticed, and thus they land into DGI. Disseminated gonococcal infection is the most common systemic complication of gonorrhea, and in like more than 80% of DGI, the gonococci can be actually cultured from the primary mucosal site of infection. So this is interesting. So this was about dermatitis arthritis syndrome. There are other presentations of disseminated gonococcal infection. The first is arthritis. The patient only presents with the arthritis part, and the most common joints that are involved are the knee joint, the ankle joint and the small joints of the feet. In hands, the wrist and the metacarpophalangeal joints are involved. Next, we can see conjunctivitis and iritis, sometimes iritis as in eyes. In heart, endocarditis might be seen, and the aortic valve may be involved. Pericarditis also uncommonly can be seen. Lastly, there can be meningitis in some cases of DGI, but we should know that arthritis, out of these arthritis is common, and even eyes can be affected, but the endocarditis and the meningitis, pericarditis are uncommon. Remember that these four systems can be included in the DGI, but they can present separately as well. If you get a short note on systemic complications of gonorrhea, always write the treatment of these complications, which I'll be dealing with in my subsequent videos. For now, thank you very much for listening. Bye.